Hi class! In Chapter 1, we saw the importance of communicating effectively and sensitively with patients, and that these skills can be learned. In this chapter, we are going to examine these skills in more details. You must have a favorite song, don't you? What is the structure of a complete song? There should be prelude, verse, refrain, interlude, and ending, right? To make a melodious song, the arranger must make sure the parts are in harmony. In this chapter, I want to compare the whole consultation process to a song. To achieve this process perfectly, we need to coordinate the various steps. Before entering the conversation, we should think about the format that you are going to choose for this interview. Just like a song before it's written, the arranger has to make sure it's pop or classic or rock. At present, doctor-patient interview is mainly divided into two types, doctor-centered and patient-centered. Traditionally, doctors have taken the dominant role in a consultation, aiming to interpret the patient's symptoms from the perspective of disease and pathology. This has been called the doctor-centered style of communication and was accepted by most patients. In this mode of communication, doctors often approach to directive. The patient-centered approach to interviewing has been described as entering the patient's world to see illness through the patient's eyes. In this mode of communication, doctor takes an open and facilitative approach. Patients is encouraged to talk, and doctors spends more time listening. We can make a table to summarize and compare the differences between the two ways of doctor-patient communication in terms of process, content, and the roles of doctor and patient.
Your doctor said that you have a cough. How long have you had it, and is there anything else wrong?
I had it for 6 months and sometimes a week.
Do you smoke?
Well, I'm trying to cut it down. Now I only smoke 2 cigarettes in the evening.
It seems like your symptoms are due to your smoking. I strongly advise you to stop smoking. And I will give you X-ray, chest test, and other tests. And I will see you in 1 month. Your doctor said that you have a cough. Please, could you tell me more about it? And is there any other symptom you may have?
I had this cough for 2 months, sometimes a week, particularly in the morning. I always feel short of breath.
Okay. Could you tell me if you bring up any sputum when you cough?
Yes, sometimes I do in the morning. I think that's because I smoke. Also, I wheeze. I think that's due to my office because there's air conditioning there.
Okay. You seem to have two concerns. First, you want to stop smoking, and I am sure this is important for your health. Second, you are worried about your work. How do you think that I can help you?
I'd like some help to stop smoking, and because I have a lot of time off work recently, I'm really scared I will lose my job and get behind with. So I'd like you to write a letter to my doctor in my office.
Okay.
A growing number of people believe that patient-centered style of consultation results in patients who are more satisfied, more likely to adhere to treatment, and have better health outcomes. In this mode of conversation, doctors providing care that is respectful of and responsive to individual patients' preference, needs, and values, and ensuring that patient values guide all clinic decisions. The features of a patient-centered consultation are exploring the patient's experience of illness, exploring the patient's knowledge of his or her illness, allowing patients to express their beliefs about their illness, allowing patients to express their concerns about the impact of their illness on their life, treating the patient as a partner when discussing treatment. And then, is patient-centered interviewing always be appropriate? Apart from emergency situations, patient-centered interviewing is appropriate in most consultations and leads to better outcomes for the patient and doctor. However, it is important to remember that some patients prefer doctor-centered consultations. They want the doctor to take a more paternalistic approach and to take charge of the consultation and their treatments.